Welcome, everyone, to this episode of Recovery Rockstar. My name is Melinda. I'm a person in long-term recovery. What that means to me is that I have not had to use a substance since December 28, 2011, and I am eternally grateful for the people that paved the way for me. I continue to highlight that each episode because it's not of my doing, but the people that had the courage to go before me and then had the love and tolerance and patience to show me the way. I am extremely excited for this month's episode. You'll probably notice that the show is 1 hour as opposed to a half hour, and that's because I have 4 amazing guests. The first thing I want to highlight is, once again, Narcan, also naloxone, the overdose kits that are readily available for anyone and everyone. If you're unsure if you're someone who should have your kit, my one question is, if you ever leave your house, you ought to have a kit. It's better to have a kit and never need it than to need one and not have it. I encourage people to connect with your local recovery centers. There are so many pilot sites available now, which is exciting. You can look on the Department of Health's website to find the local pilot sites, but the recovery centers also have amazing resources. I like to highlight the Vermont Recovery Network, which will show you the information for all 12 centers in the state of Vermont. Locally here in Franklin and Grand Isle County, we have the Turning Point of Franklin County on Lake Street, and they are also a pilot site for Narcan, overdose kits, the harm reduction packs, and have a slew of supportive programs available to anyone and everyone, and you don't have to pay for these services, which is just beautiful. I also just want to remind people that to learn more, while COVID has been a huge focus, and I think that is important, I also think that there hasn't been enough focus on overdose fatalities and overdoses altogether. There has been an increase of 38+% of overdoses from 2019 to 2020. And sadly, I've seen the data of this year so far, and the numbers are not going down. So I really encourage people to reach out, get help. There are so many resources available. Like I said, go to your local Turning Point, your recovery center, learn more about what's available in your area, and more than anything, just know that anyone can recover. So with that, I'm going to hop right into this episode. I have 4 awesome guests that I am so excited to introduce. And what we're going to do is talk a little bit about an event that's going to be happening this year. And then we're also going to talk about their recovery journeys. And I'm going to start with asking just one of these amazing guests, Ron, to tell me just an overview, a summary of what's this event that we're hearing about.
I'll try to give you the Reader's Digest version to start here. I had an idea a while ago where I wanted to do something during Recovery Month to showcase the incredible value of recovery, and also to do something to support our recovery pillars. And the first iteration was a bit of an off-the-wall idea, and my handler, Peter, reeled me in. And so it became more about the messaging and an opportunity. And the messaging is, look, people can and do recover with support. They recover all the time. There are thousands of Vermonters like us who have recovered. And so the idea behind it was to showcase that, but not just that folks recover, but the incredible value they bring to their communities. Mm. And they're able to do that because of the support of our 3 recovery pillars in Vermont: Recovery Vermont, the Vermont Alliance of Recovery Residences, and our Turning Point centers through the Vermont Recovery Network. So part of this, aside from raising just awareness, is to raise some much needed dollars to support these organizations, to support the next generation of folks in recovery. And I think that's enough for me.
I love it. Thank you so much, Ron. And I think I will mention that you and I had touched base. And as soon as I heard about this event, it was critical, to me anyway, to get this team together, if they're willing to come to St. Albans, so we can first and foremost talk about recovery, highlight briefly the recovery stories, and especially highlight this event, because I have this vision that as time goes on, it's going to be another one of those events that people will know, hey, isn't that annual event coming up, and can be part of and participate. And I think it's helpful for people to know not to let fear hold them back from participating in these events. You don't only have to be a person in recovery. Family members in recovery, people who want to learn more, can learn more by going to these events. So super grateful for your leadership on that. So what I'm going to do is I'm just going to ask you all, for starters, because I've got so many questions and we won't get to them all today, But I'm going to start with you, Ron, just to tell me a little bit about your life as a person in recovery in the earlier days, like recognizing that you may have been struggling with addiction.
Oh, there was no may about it. I think it was a mystery to me and not anyone else. My journey's a little bit unique in the sense that my drinking manifested really late in life. And it went almost from being a responsible drinker to being an irresponsible drinker. And knowing very, very early on that this health condition, and it took me a while to understand that this is a health condition. It's not an individual choice. It wasn't a character flaw, but yet you have those feelings of blame and shame, and you begin to isolate for fear of how you're going to be talked to, treated, and judged. Mm-hmm. I was really, really very fortunate that an event occurred that forced me to make a decision the next day. And the next day was to reach out for help and support from the recovery community. And since that day, the desire to drink was lifted from me. And I think what really, really supports my recovery is not only working for a business that supports recovery, both in its employees and what it does in the community, but being able to work with folks like Dave, Tracy, and Peter. The work that they do especially is just so empowering, and I don't even know if I can really put into words the respect and admiration I have for folks that do the direct service work, because that's where the rubber meets the road. And the more that, as Johann Hari said, the opposite of addiction isn't sobriety, it's connection. And that's exactly what these organizations do.
Mm-hmm. I love it. I love that you highlighted that the opposite of addiction is connection. That's something that on this show I really try to make sure it's clear to viewers, especially when COVID was happening. Just because you can't be next to somebody physically doesn't mean you can't be connected. I love that you highlighted that. Thank you so much.
You're welcome.
So I'm going to move on to you, David. Tell me, who are you? And tell me a little bit about the earlier days of your addiction.
Sure. My name's David Regal, and I am a person in long-term recovery, which to me means that I haven't used a mood or mind-altering substance without the direction of a doctor since January of 2007. And I loved drinking. I mean, from day one, I can just remember it took away all the discomfort that I had in the pit of my stomach for all those years leading up to it. And it was right off the bat that I really knew like that was my medicine. And when I got into recovery, it became pretty clear to me that drinking wasn't my problem. I actually drink really well. My problem, right, is sobriety. I can't function in the world without drugs or alcohol in my body, and without that feeling and that support and that crutch. And it took me a long time to really develop the skill sets necessary, not only to have a firm basis in recovery, but also the life skills necessary to be able to interact with other people, to be able to pay my bills. I didn't know how to do laundry when I went to treatment. Like, no joke, after I got out. So I went to, some of you will remember Maple Leaf Farm, and when I got out of treatment, I had some roommates, and I was really lucky that my roommates then were willing to not use substances in our apartment. And as a result of that, we had a bunch of people that sort of ended up sleeping on the floor and sleeping on the couch and like bunking in with us, because the places that they were going to go back to after treatment weren't safe places. Wow. And I learned to do laundry from some of those people. They taught me as my peers walking this path, and I had a car that was registered and insured, and I had a valid driver's license, and that wasn't true for everybody coming out of treatment. And so I was able to bring something to the table, and together we were able to support each other going through. And a lot of my early days, my recovery is rooted in a 12-step program, and it was all about connection with other people and fellowship and supporting and giving back and being of service and trying to help others. And, I was fortunate enough with some extra support to purchase a home, probably I would say maybe a year and a half into my sobriety journey. And that was filled with people who were also in recovery. And that sort of led to my passion of recovery residences. And eventually Andrew Gagne and I got together. We were on parallel tracks and our paths finally crossed, and we said, let's do this for real, and started Vermont Foundation of Recovery in late 2013 with a loan and in the hole and no houses. And, now we're 7 years later, and we have 6 different locations and 3 transitional apartments, and we serve we have space for up to 40 individuals at this point, and we have 7 or so individuals who are also in recovery that are employees. We have a board of directors that's mostly people in recovery, and we're just really blessed to have the opportunity to give back and try to be of service. And I think what Ron mentioned in terms of Dominion and this project and bringing these organizations together is that I think a lot of times that phrase about the opposite of addiction being connection is somewhat directed, or maybe even I just interpret it as the individuals, which I think is certainly really important in terms of peers and people who are in recovery. But I also think it's critical for us to be looking at how are we connected as organizations, and how are we as the people that are trying to give back and trying to support and trying to be as service to the very best of our abilities, making sure that we're connected with each other and supporting each other, which I think allows organizations like V4 to do what we do best, which is recovery residences, and then let organizations like the recovery centers do what they do best, and let organizations like Dominion step in and sort of allow this forum for all of us to come together and be connected, and a platform and the organization that Peter works with, to sort of have this overarching support of all of us is so critical that we are all connected at an organizational level, because I think it facilitates this opportunity for everybody as individuals to become even more connected. And that gives us the opportunity to really grow and to give back to society. Because I think Ron also mentioned this idea of the value of people who are in recovery. And I don't know about anybody else around this table, but the value that I had to society was in the red when I was active, right? Like I was a draw on society. And you can look at a lot of different statistics to figure out like how much of a draw I was. But in recovery, right, I've been employed, since I think it was within the first 6 months of my, I entered recovery in January and I started employment in May. And I've been employed every day since May of 2007 and paid taxes and given back to society, right? Like I've served on board of directors, been a part of starting or part of the founding board for at least 2 organizations as nonprofits in Vermont. And that's true for so many other people. Like people in recovery have higher than average earning potential. People who are in recovery are the first ones to want to coach baseball or softball teams and be involved in community, boards or select boards of service to, community, county, state, national, like whatever the level is, and really give back. So I think it's important to bring that up, because it's not just the right thing to do morally and ethically to support people who are in recovery. It's the right thing for society and community to support people who are in, recovery and really making sure that we are able to be connected. So
I love that. You know, as I'm listening to you, you highlight so many things that on this show I try to reinforce as much as possible. And I've often said that same quote where people who are in recovery have a performance above average. And there are statistics that'll show that. And I think a lot of it is just that resilience and the commitment and the heart and the passion that we have when we get in recovery. You were also talking about when you had first gotten in your journey, and there's a house full of people in recovery, and one has the valid driver's license, the other knows how to do laundry. And when we did the community addiction workshop with Dr. Hawk prior to COVID, sadly kind of putting that on hold, I'll say, but there was a focus that we looked at called the Tale of Seven Shovels. And it's basically about, we can't wait for, you know, the states and feds, there's a lot of great programs and all this stuff, but at the end of the day in our community, all of those little gaps, we can't wait for a bucket loader to come and fill it. We each grab a shovel. So we were getting the Swanton community at the time to step up. So if somebody works as a mechanic, they'll do some oil changes for free for somebody new in recovery. If somebody has a valid driver's license, they, you know, so I just love that as you're sharing that, when we look at the big picture and the social matrix of an individual and the pieces that are missing, we can bring those to others and help them get those gaps filled. And I think also as service providers and the work that we do in recovery, it's a similar thing where there's going to be systems that are just not tightened the way that they ought to be. But because I look at 5 of us who work so closely, can say friend, co-worker, you know, almost family feeling, where that's the bridge. The relationship is the bridge. So I know I can do a warm handoff if somebody's looking for recovery coaching training. I've met Peter. I've sat with him. We've had coffee together. He's amazing. So it's not just, oh, here's an organization. Here's a human being that I am fond of, that I know I can entrust you with. So, you know, so I think that's the beauty of the work that we do. As you said, it's the relationship as people in recovery and also doing the work, because it's not like other organizations and corporations where, well, that's the, I hear a lot of times, well, that's our opponent and that's the challenger. And it's like, we don't have that. We're not selling vacuum cleaners. We're trying to help people not die of addiction.
That's right.
So there is no such thing as having, you know, any kind of like, you know, want to be better than the next one. It's not like that. It's like, let's get people connected to the best fit. So I thank you for that. Tracy, you've been a superstar as I've watched, you know, through the years. I remember as Dave was talking about when they were getting ready to start their houses, I remember that because I was new in recovery. And for me, in my recovery, I've watched you over the journey and the work that you've done. Huge fan of the Project Vision movement, huge fan of the work that the Turning Point has done to partner with other organizations, and especially a huge fan that you've been vocal and open about your story and being a person in recovery too. So tell me a little bit about who's Tracy?
Who's Tracy? Well, I'm Tracy Houck. I'm the director of the Rutland Turning Point. I've been in recovery since May 15, 2013. My story is kind of unique. I was a registered nurse for 29 years, very well respected in my role, hard worker. I was married at the time, beautiful daughter. And I played all the roles. And you know, I did them very well, but I also had a problem with a back issue. I had a herniated disc, and that's what kind of started my addiction. I had been given pain pills. I had to wait 6 months before I could get surgery. So, you know, the doctor that I worked for at the time, you know, was giving me pain pills. This was back in the late 90s, like 98. And, you know, I wasn't really happy in my family life. You know, it wasn't anything abusive or terrible. It just wasn't a good mix. And, you know, so I was feeling unhappy but scared, didn't know what to do, didn't want to tear apart the family, getting a divorce, you know, all that stuff. So once I started taking those pills, I realized that, you know, and I think I had heard once at a presentation about opiates and what they provide to people. And one of the biggest things that struck me was it says this sense of well-being when you take an opiate, right? Well, that's what happened to me. It was, you know, I mean, I still, to this day, can actually imagine what it was like just to know I had the pills.
Yep.
And can get the feeling, which is a scary thing because you can get that feeling all over again. And, you know, I had them for a while then. I had my back surgery, you know, then I kind of got off them, and then we moved to Vermont, and I got a job in Vermont. And, started working for a physician. And then something happened. I had a flare up of my back, so they gave me a small prescription of opiates, and that started my wheels turning. It was kind of, I actually was in charge of the monthly prescriptions for people that were on opiates and whatever pain meds they were on for the doctor. So, what is really sneaky is that, I gauged my use based on their use, right? Like I started with forging my own prescriptions, phoning them in. Nobody knew. I didn't get caught. I got away with it for a long time. But I would always, when I'd start feeling like, this is wrong, I have to stop this, then I would say, well, look at what these people are getting every month. And I would do that crazy thing, like I'd phone in a prescription, I'd go pick it up at the pharmacy, and then I'd be like, well, it's a legal prescription. Well, it's not a legal prescription, And I did that for a couple years, and then I got caught. I had left working at the doctor's office that I worked at. I was working at a nursing home. And I had phoned in one of the prescriptions. And the amounts kept increasing, and I could put refills on it. Vicodin was my drug of choice. And, so I was running out. So I phoned it in. And then a little later that morning, I got a phone call from the doctor I used to work for, who we were very close. And he just said, I got a call from the pharmacy about this prescription. Do you know anything about it? And I said, no, I have no idea. Well, then he prompted to check with and I just knew. I was like, oh my God. And he called me the next day, and I just admitted it. I said, yes, I did. And, he said, well, get yourself an attorney because I have to report it to the nursing board. So my license was suspended. That was my world, that was my identity. Had to tell my husband at the time, had to tell my daughter, who was 16, 17 at the time. It was a very humbling experience. And I never bought drugs on the street. So I was alone. I get emotional when I think about this. But if the ground could have opened up and swallowed me, I would have gone readily. But, I went through the channels of the nursing board and what I had to do, and I had to get a licensed alcohol and drug counselor, and she told me that I needed to go to a 12-step meeting. I knew nothing about 12 steps, and where she told me to go was down to she just said, just find one and go. And I happened to look, and the first one I came across was at the Turning Point Center of Rutland, which I had no clue what Turning Point was. And first of all, at that point in my life, I wouldn't go down to State Street after dark on my own anyway, because that's where those people were, because I lived on the good side of town. And so I went to that meeting, and I was scared to death. I went by myself. I walked in the door, and they were doing Friday night dinners at that time. It was a Friday night meeting. And I walked in and not knowing what to expect, but the people there just didn't ask me why I was there. Just welcomed me. I felt safe, and then I started, meeting with my alcohol and drug counselor. I continued going to meetings. I started feeling safe. Didn't know what I wanted to do for work, because even when I got my conditional license back, people would know, and it was kind of awkward. So I just continued. I did my community service down there 100 hours. I volunteered, and then I got a small position down there as I don't even know what it was at the time. It was just a stipend position. And, I continued on that path, and I went to the Recovery Coach Academy. I became a recovery coach. And I think back to that. Like, I think back to where I was early in recovery, and going to a lot of 12-step meetings and meeting the people I was meeting at the centers. There was a portion of me that was still like, I'm different than. Like I wasn't as bad. I hadn't been to jail. I hadn't been to 15 rehabs. I hadn't ever overdosed. And it took me probably a good year of being involved to realize that, I am no different than them. Just my circumstances were different, and I didn't face as many consequences. And I realized how biased I was, and I realized how judgmental I had been previously. And it was just the the most life-changing experience I've ever had at that center. And, you know, I stayed involved there, and then in 2015, you know, I still was unsure whether I was going to go back into nursing. And, you know, the previous director ended up resigning, and they had nobody to run the center. And I remember the board coming up to me and saying, would you step in as interim director? And I knew nothing about being a director of a center. I knew nothing about running nonprofits. But I did know that if I didn't step up, that center probably wouldn't survive. Mm-hmm. And, you know, because there was really no staff there at that time, you know, and I know what it gave me, and I couldn't take that away from the people that were coming there. I couldn't. It was like, no. And plus I had this feeling like, I don't know where this is going to go, but this is where I'm supposed to be. Yep. And I don't know what it's going to look like. You know, and it's just been the most amazing journey, and you know, all of these agencies have been a big part of it, you know, and the learning curve, and you know, we've just grown so much at our recovery center. You know, we just want to do whatever we need to do to help the people that are still suffering, because they can't get any better if they're dead. Mm-hmm. They just can't, you know, and I know what it's like to feel at your bottom, and I would have given anything to know other nurses that have gone through it, and that's kind of been my mission. Like, even if you're a professional, you know, admit it, let's talk about it, let's have that conversation, because you know, there's a lot of people suffering, families and everything. And you know, we developed a program at our center that the one that I'm the most proud of, is where we started going into the correctional facility. Mm-hmm. And doing recovery coaching and, you know, recovery support groups. And it's amazing. It's like, it was intimidating at first because I was, you know, one of the ones going into this male facility, but it was beautiful because I learned how to look at people as just people, another human being that's struggling. I don't have to judge them. I don't have to look at what they've done in the past. I have to look at where do they want to go from here, you know? And you know, I'm excited about this event. I get excited about Recovery Month, and I am just, it's not about me, you know, it's about giving back. And I see, you know, all my staff is, I've never advertised for a job. Yeah. They just come. Mm-hmm. They want to do it. And that's the most beautiful thing, you know, and I wouldn't be where I am today if it wasn't for my addiction and what I learned in my recovery process. So I'm not ashamed of it. Right. I'm grateful for it. Yeah. Yeah.
Oh, I love that. Tracy, thank you so much.
You're welcome.
You know, when I hear some of the things that you're saying, I can totally identify with not realizing, for myself anyway, how biased and judgmental I was until I got to recovery this time, right? So it took a few times. And at the first time, it was very easy to find people that did a lot worse than me. So maybe mine isn't so bad. It has just that reservation, you know. It's all, I wasn't ready to accept it. And even throughout my addiction, when I'd looked back, and I've shared it openly in the past, you know, I got a DWI alcohol related when I was 18. Then again when I was 21. And it's like, okay, well, this is kind of creating trouble, and opiates don't smell, so we'll do that. But even in my brain, it was like, well, I'm not putting anything up my nose, and I'm not shooting up. I always had these things, and yet those not yets eventually all ended up happening. You know, it took
Think about how many times you talk to individuals that are still struggling, and they say, oh, I said I'd never use a needle.
Yeah. Exactly.
You know,
exactly.
It happens.
You know, I learned a lot more about my my bias, you know, a little bit implicit, but especially my explicit bias through the Recovery Coach Academy. Because I remember reflecting on the fact that, you know, before I got in recovery, well, as long as I don't do this, this, and this, I don't really have an issue. And of course, all those things happened. But then also in the journey where it's like, for me, medication wasn't a part of my journey. So I had it set in my mind that, well, no, real recovery is, you know, you don't use anything. And yet, doing the Recovery Coach Academy and meeting and working with people who are on a medication-assisted treatment, well, if that's the journey that works for them, thank God for that resource. Yeah. Similar to, you know, the faith-based, which again is a piece too, but, you know, there's so many paths to recovery. And I know for me, having worked at the Turning Point in Franklin County, and that was really the first experience and even thinking to work in the field was at that recovery center that openly embraced me. And when you talked about the feeling, the sense of well-being, that was an irrational situation when we were using, but yet we felt that well-being when we used. I found that I started getting that overwhelming sense of well-being in the recovery centers around peers. And what a beautiful thing that we can get that through connection and people, and not on something that it's going to require more and more to eventually kill us. Like it's a foot out of the grave into, I often said getting in recovery, it didn't open up the gates of heaven, but it opened up the gates of hell so I could climb out. But I can honestly say there's those moments that it's like, this must be what heaven's like, that feeling in our hearts when we're around peers, when we see the light come on for somebody who's struggled so much. I just thank you, because like I said, I've listened to shows you've been on, I've heard you speak, and just the beauty that shines from your story, it really hits my heart. Thank you for that. I'm going to move now to Mr. Peter. So, Peter, of course, our viewers had a chance to see you. It was over a year ago. We're going close to 2 years now. But tell people, who's Peter?
Yeah, I just want to echo what Tracy was saying. It almost is a blessing having suffered from substance use disorder because of what it does open up at the other end. So I'm Peter Espenshade. I'm president of an organization called Recovery Vermont. We celebrate recovery, which is a really terrific mission, through trainings, through advocacy, through leadership programs. My own recovery journey came about, probably like everybody's, thanks to some really loving and wise people who showed me, I think, a number of things. One, that I thought recovery was just going to be about abstinence. I thought I was going to stop using whatever substances of choice I was using at the time and all my problems would be solved, right? That's not the case, because not only had I caused some harm and some damage and disconnected from some beautiful people, and I wanted to reconnect with them, I wanted to make amends to them, and wanted to be a better person. It just also sort of opened up the work I needed to do, right? So I removed the substances. There was still something in there that needed to be reconnected to life and reconnected to a healthy life. So I was lucky through those same folks to create kind of a suite of things that worked for me. I think recovery is a highly individual journey. I don't think there's one path that sort of suits all. And for me, it was this combination of mental health, physical health, and mindfulness that allowed me to reconnect with loved ones, with family who I'd lost touch with through my career, through my community, and it really was that connection that I define as my recovery, at least. It wasn't the abstinence that defines my recovery. It was reconnecting to life in a really healthy way. And all of that pain and heartache and that whole health condition that is substance use disorder truly was a blessing for me, because it allowed me to say over a course of years what matters in life, like what's really important. How do I want to take this one life that I've been blessed with on this earth and use it in my own clumsy way to the best I can? And to me, that's been in celebrating every single second, and in working with others to get them to celebrate their own lives wherever they are. It's hard sometimes to celebrate what we're doing and to celebrate recovery, because we are in the middle of an epidemic that's been going on for a long time now. The opioid use disorder epidemic has been going on since roughly 2013, 2014. And we have needlessly lost so many beautiful people. And those numbers are going up, sadly, through COVID. And we need to honor that. And we need to always shine this beacon that people recover. And we need to keep that beacon strong and bright and let folks know that this is not hopeless. That no matter where one is, if you're still, above ground, there is hope. And there are in Vermont wraparound services that will reconnect you to a healthy, meaningful life. Because recovery is about connection. It's about reconnecting to a place to live, right? It's about reconnecting to a community of friends who accept you for who you are. It's about reconnecting to wonderful healthcare services that we have in Vermont. There's a really good story here. And there's a really good story here that understandably, gets covered by the drama of look at all these deaths, look at all this thing, how are we ever going to overcome it? We have to believe that we can overcome it, or we're not human. We're not our best selves. And I'm not being corny when I say it's a real honor to be here with these folks who dedicate every second of their life, who are dedicating everything from their personal income, their personal homes, to share with folks in recovery, to being there 24/7 to their communities. Recovery is possible, and we need to celebrate that fact to shine that light bright for folks. It happened to me, and I feel so blessed for that, for the patience that was given me, for the way my family treated me, for the fact that my family still is there for me and talks to me still. And I really mean that. Every time I'll see my wife or my daughters, my heart breaks, because they were there for me at my very, very worst, when I was just sort of a monster, because I wasn't me. I was self-medicating with something that was trying to quash me down. And the recovery has allowed me to bring me into the light and connect with the best parts of me, which are the healthiest parts. Kind of as I define them. So recovery is an individual journey. Somebody, and many folks actually showed me that, and I was fortunate to have the supports to create my own sort of suite that worked for me to pursue my own journey. I am so blessed, and so blessed to be able to take that and give it back in my own way and pay it forward.
I just love that, Peter. Thank you so much for sharing. I mean, so many things that you're saying are just resonating and definitely making my heart so warm. A huge thing that took my attention when you mentioned, we do see the loss of people. We do see what's going on. It's heartbreaking. It's also happening, so we don't want to, pretend it's not. But on the flip side, I feel like we get to see so many more miracles than the
Yes.
general public get to.
Yep.
That how can we get more out there, more of those recovery journeys and stories, and also people that are willing to say, I got in trouble with the law. I almost lost my health. I mean, for me, I was, I personally overdosed a few times. So how can we help people realize it doesn't matter how far down to the bottom you've gotten, you can recover, because people see. I look at you. And I'm hearing you say, well, when I was a monster with my family, I can't picture you being a monster.
Yeah.
People have said that to me. I can't picture you being high and drunk and shooting up and all this. And it's like, yeah, and that's a blessing. I also think it's important for people to know that if they're struggling with that behavior right now, then maybe you don't see it, but I see that it can happen for you. So we
Yeah.
love people till they can love themselves. We believe in them until they can believe in themselves. And I just think it's so cool that I know at least the people in this room are super passionate about getting out there and sharing information and your stories and letting people know that people do recover, because I think it's stifled. The hope, the excitement, the beauty of recovery is stifled much more than the darkness.
Absolutely.
So I'm just so grateful for how you're highlighting that, and also the path to recovery. There is no one way. It can incorporate pieces from the many paths. It could be one straight path. I have been blessed to see people recover from so many different ways that I'm fully convinced, and I know this, I have no clue what, my creator's plan is for everybody else's journey. So my goal isn't to say, well, you ought to do this and this and this. No, it's to say, here's the slew of ideas, what feels right to you.
Exactly,
And then meet them where they're at, as we say.
And I think, I always say, progress, not perfection.
Thank God for that.
I know so many people that have struggled to, and maybe they're not you know, they still have a ways to go, but being able to recognize the progress that they have made to head towards recovery, you know, improving things in their lives, becoming responsible, maintaining a job. You know, those things are important things, and when they start to gain those, they're less likely to want to lose them. You know, and I had a beautiful thing that happened a couple weeks ago. There's an individual that has been getting coaching through one of my coaches at the center for about 2 years. And I've known him before that, and he kind of, you know, big talker, like, yep, I'm good. And he called out of the blue the other day. He celebrated 2 years in recovery. He still sees the recovery coach that he has at the center, and he called me specifically to tell me thank you. And I said, well, for what? And he said, well, I got 2 years, and I just want to say thank you for everything. And I said, well, you did the work. And he said, no. He said, I realize now that you saw something in me that I didn't see in me back then. And now I see it. And those moments are far and few between when you see them or when you get them, but that alone, because the effect on his family, you know, new friends, new life, I don't know, it's just, that's what we do this work for.
I love that, and it's true that others see the miracles starting to happen before in us than we see. You know, like we don't see it in ourselves as much, but others start pointing it out.
Yeah.
And that's why I think that connection with peers and people in recovery who can say, "Hey, I've noticed you've done some great growth." That goes a long way, and it's almost hard for people that are newer in recovery to really believe it, but yet they trust so much in the individuals that are delivering that information that it gives them. I think I like to call it a more accurate snapshot. Let me be an accurate mirror for you. Maybe you're still feeling icky inside, but the reality is, how much courage does it take to suit up and show up and come to this place that recovery's offered, to go to a meeting, to go to a counselor, you know, whatever it might be. Thank you for sharing that. And what I want to do now, I'm going to turn and look at Ron again, because as much as I wish we had like 10 hours to do this show, we have an hour, and we're getting a little bit closer to the last quarter of the hour. And what I really want to focus on, I touched on it a little bit, and to the viewers, there's an event that's going to be taking place. I did ask Ron to give us an overview in the beginning, but now I want to get into the meat and potatoes. What is this event that you are...
We've affectionately called it the Recovery Challenge. And the challenge is not a push-up challenge or my crazy idea of a sit-up challenge, but to challenge perception. And as Tracy said, progress. Substance use disorders are progressive. And when the lens is seen solely through a person's addiction, that lens is not a good lens. It's not accurate, and it's not kind. But why not celebrate the progressive nature of recovery?
Right.
You know, just as substances can address pain and can provide euphoria, more often than not, they're used to address all kinds of pain, physical, emotional, trauma-based backgrounds. And for many, the disorder sneaks up on them, and it has a hold of you despite all your best intentions. And for many, many out there, the lack of understanding what substance use disorder is, it's blame the person as opposed to blame the health condition.
Right.
And it is a health condition.
Yeah.
It's a diseased model of care. Plain and simple. Hypertension, diabetes, substance use disorder, all diagnosed and treated in the same way. So the Recovery Challenge was designed to, all right, you know what? We've got 3 pillars in Vermont. Recovery Vermont, who trains our recovery coaches. They have taken the lead on Vermont's recovery-friendly workplace initiative. And make no mistake, individuals in recovery are the least likely subgroup to leave their employer. Evidence shows this. We have the Vermont Recovery Network, our recovery centers. The daily and weekly 24/7 programming that they provide, on the easiest of days, it's simply providing access to a 12-step meeting. But what about new moms in recovery? What about employment consultants? What about the recovery coaches that work daily in our recovery centers to help folks like us and those who follow us to have a lifetime of joy and happiness, to be part of a community, to be embraced and to support our communities? And then, of course, the recovery residences. What V4 has done has really set the standard for recovery residences in Vermont. So when you bring these three together, recovery coaching, employment and recovery centers, and recovery housing, talk about wraparound services and a welcoming. You're welcome here because of you. Because of you. And so my vision really was to showcase recovery, to address the progressive nature of recovery, that with support, it happens all the time. And unfortunately, many people in recovery won't self-disclose for fear of how they'll be judged. So I have deep respect for all of you. And then lastly is they're all nonprofit organizations. So aside from showcasing the value of recovery, sharing what we already do and do really well, is to provide the opportunity for businesses and individuals to support them. Recovery Vermont is the fiscal agent. They will receive, process all donations, pay any related fees, so that our vision of 100% of what is donated goes to our centers and goes to our homes.
I just love that. You know what? As you're sharing the focal points of this challenge, I think of in this community, a few years ago, we had a forum, and it was actually prompted by the Project Vision, where a team came, and the terminology, the Formidable Four, had been kind of named and came up of the housing, substance use disorder, employment, and I'm thinking childcare. Yep, so those were the Formidable Four. And when I hear what you're talking about, I mean, Moms in Recovery, there's programs I know at your center, at our local center, when you're talking about the progressive workforce, you know, all of those things you're talking about, those key pieces that oftentimes people might, if they don't know a lot about treatment and recovery and resources, they might think it's the substances and abstinence or medicine. And yet there's, if somebody's new in recovery and they don't have a safe place to live, I look at like the recovery residences, and I try to be as loud and advocating as possible, because we have an addiction crisis and we have a housing crisis, and oh my gosh, here's a solution to both, put in how brilliant, so let's get some support. So just the fact that you highlight the focus areas, it's not just about let's get people to not use substances, it's about well-being, that social matrix, your whole body experience, mind, spirit, you know, so I just love that. And as we're, you know, getting a little bit closer to the end of the show, I'd like to just touch base with Dave, ask you what your feeling or your hope for the messaging on this event is.
Well, I mean, I think the real beauty here is about connection, and it's connecting. So you were talking about each one of those resources, right? But it's really about how they interplay. Right. It's about how all of those separately are fantastic, but when you combine them for an individual, the power that's there with that is just tremendous. And so, you know, I really hope that the conversation and the messaging is really about this concept that recovery is available to anybody who wants it, and that there are organizations that are interested in working together, and I think we would all say that we are open to any other organization out there that provides support to people in recovery to partner with us. Even if you don't provide support directly to people in recovery, if you are a medical provider, if you are any organization in the community and you want to be a part of supporting people who are in recovery, please come and talk to us. Please come and partner with us, because we're stronger together. And, you know, I hope that we can start to raise awareness about what recovery residences are. I hope that we can raise awareness about VTAR, which is the Vermont Alliance of Recovery Residences, because they bring national standards to the state of Vermont. They certify recovery residences to those national standards. There are codes of ethics. You know, I think it was really shown by what Tracy sort of expressed in terms of her willingness as a person in recovery to step up and to just take on a challenge, not really knowing what was on the other side of that or not feeling equipped or experienced, but doing it anyway. Because if we don't do it, who's going to? And I think a lot of us feel that way in our work, and we want to make sure that we're able to be there and supportive, and that's how things started. But recovery residences have come a long way, and it's with the professionalism that comes along with the training that takes place from Recovery Vermont, and it's the support and the feedback that comes from the recovery centers, and it's organizations like Dominion shining a spotlight on all of these things. And it's VTAR bringing these national standards and best practices and ways of evolving and doing things to the state of Vermont that allows recovery residences to begin this expansion process throughout the state and work in local communities. And I would just encourage anybody to get involved. Go to your local Turning Point Center or Recovery Center and ask questions and learn about what recovery is and what are the supports that are out there and how can you be a part of it. And if you're at a community meeting or you're listening to people speak from a place of stigma or speak from a place of fear, try to speak up. Like, try to share that other side that we're talking about people. You know, we're talking about a health condition, right? We're talking about things that are of benefit to our communities as a whole. And, you know, I just think it's a really great opportunity to shine a light on the positive nature of all the work that people are doing and to really help Vermonters as a whole start to understand the recovery side of this story.
I love that, Dave. You know, it's when you're describing how, you know, when I hear Tracy stepping up, to me that's courage. And my guess is maybe there wasn't an absence of fear, but pressing through despite that fear.
That's right.
And just being asked to be of service. And we're taught, you know, I feel like we've all been taught in recovery in one way, shape, or form that if we're available for service and we're asked, we say yes. I was thinking about that with this show. I was just talking to you a few before the show. You know, I was asked by Elizabeth Malone at the time at Northwest Access, hey, can you do a show on recovery? I was like, I have no idea what I'm doing, but yes, because I know how to talk recovery, and if I'm being asked, then I have to trust I will be equipped with what I need. And that's what I think that we as people in recovery do, is if there's a need, we step up. And also what I've had to learn, sometimes the hard way, that it doesn't always have to be us personally to step up if we don't have the bandwidth, but because we have such a wonderful pool of talented people, if I'm not available, okay, but I know some great people, so making those connections.
Well, and we talked earlier about, before the show, about permission to be human.
Right.
Right, and this idea that, like, we didn't know what we were doing when we started a lot of this stuff, and we had the opportunity to fail. And we had the opportunity to learn. And that's also true in our personal recovery journeys and with everybody else's, in terms of those all paths to recovery and putting things together that work. Maybe the first mesh of resources don't work that well. You can change.
Yes.
There are other resources out there. You can explore a new path made up of different things, because we're all human.
Yeah.
I love that you highlighted that too. I appreciate it. Where of course, I work at Phoenix House New England, which is an amazing organization to work for. And I was already talking about that before, because I have that freedom and flexibility to get out with the community partners and get out and see people, to meet people where they're at, right? So not sitting in an office having the people who are hurt and suffering have to find their way to me, but I can go out and meet them. And our wonderful, fearless leader, Dr. White, our director, she was the one that the first time I heard her say that she was going to be doing a training and something small happened, and she said, permission to be human. I admired her so much, and that's what I needed to hear, because it's easy to sometimes put people on a pedestal when they're so smart and well-performing, and yet, well, you know what, she's human too. We're all human, and just knowing that maybe us being human in front of people is what somebody else needs to see, so they can know that, okay, she's not perfect, he's not perfect, they're not perfect. You know, so it just takes away that perfectionist that we tend to want to do as humans, I think, to always raise the bar. And it's like, let's just stay humble and be grateful for what we have. So Tracy, I'm going to ask you now, just a few minutes on the event and what your feelings and thoughts and perspective.
I'm excited about it. I just think that recovery needs to be highlighted. People need to come out and talk about that. And, you know, the work is so hard. You know, I know at my center, you know, I don't have time to put together any kind of big fundraiser. So I am forever grateful to the people that put this together. And it's hard to run a nonprofit and to meet the needs of the people that you serve. I mean, I can't get away from doing recovery coaching. I have people I need to coach. I mean, I will do that direct service. I'll figure out the director part later and get it worked out, you know. I'm just excited about it, and I feel very positive about things in the future. I do. I think, you know, this recovery coaches need to have some accolades about the work that they do, because it is hard, and you don't always have people following through to recovery. A lot of times they fall off and they disappear, and you don't know where they are. But that takes a toll on the recovery coaches, who are people in recovery themselves most of the time.
Right.
So, you know, and that beating up on yourself, like, oh, was it my fault? Was I not that good of a coach? This, that, whatever. You know, helping to realize that the growth of being able to realize when you're in recovery that it is not all about you, right? And it's not about your opinion, and it's not about that, but just seeing somebody grab onto something and move forward in a positive way. You know, it's hard to train people to think like that.
Yeah.
You know, and I'm excited about this event, and I think Recovery Month is going to be a wonderful month.
I know, it's so exciting, and it reminds me, it was in the month of September when I interviewed Peter, because we were saying it's Recovery Month. So I thank you so much, Tracy. And Peter, just give me a couple minutes of your thoughts and feelings on this event.
Yeah, I love the way Ron has structured this challenge. We're challenging the community to see what recovery is, to learn a little bit more, to visit a recovery residence or their recovery center. And I would love, when folks are there, to learn a little bit more about recovery coaching. We've heard it mentioned a couple of times. Why I think recovery coaching is so special is if you go to a recovery center and get matched with a recovery coach, they are not going to tell you what to do. They're not going to say, here's who you are, here's what you must do, you must follow this certain path. They're going to do something much more effective, much more evidence-based, and much more spiritual. That's really coming from the heart space, is they're going to listen. So if you're somebody who's struggling, or if you're a family member of somebody struggling, and you talk to a recovery coach, they are there to listen, to find out what's going on with you, to give you a really deep ear of, I am here to find out exactly what's going on, so you can get this off your chest, so you can think about what suite of services might work for you. There's not one size fit all. We're not just prescribing really simple prescriptions and then going away. We're here for the long term, to listen to you and to get your best self to come to the fore and unfold. It's an incredibly beautiful thing. And it works. And it works time and time again. Hundreds and hundreds of Vermonters, thousands of Vermonters, strengthen their recovery every single month, every single year. And let's celebrate that, right? Let's celebrate that. It's a statistical fact, and it's a spiritual fact. It's sort of the best parts of being a human being.
I love it. Thank you so much. I want to thank all of you. We are at our last minute and a half. I'm just going to look to Ron. Is there any other detail that you think is important to make sure that we get in, or do you feel like this has been...
My vision and Dominion's vision was, this is not a Dominion program, but something that we wanted to be part of, to support more from a background, because we don't do the direct service work. We don't train the coaches. We don't house folks in a safe, supportive home. We don't provide the recovery coaching. So, but what we really wanted to do was to shine a light on the value individuals in recovery bring. We wanted to showcase and raise awareness to all the wonderful things that are currently being done. And I'd be willing to guess that it's been thousands and thousands and thousands between these three organizations. We're only 650,000 people, so I wouldn't be surprised if these three organizations have touched the hearts and mind of at least half of the folks in Vermont. And then aside from that is to showcase that if you value recovery and you understand and support and value the work they do, we're providing the opportunity to make a contribution through Recovery Vermont so that every penny donated can go to support these organizations.
Love it. Thank you so much. I want to thank the four of you for coming here. It feels almost like a little family reunion. I want to thank all the viewers. I am so grateful for everybody who's had an opportunity to Zoom in to watch this show and to learn more about this event coming up. So again, anybody can recover. All you have to do is reach out. There are so many resources. I encourage you to reach out and look up at, again, the Vermont Recovery Network, your local recovery center. And more than anything, keep watching the show so we can keep you informed. We'll see you next time on Recovery Rockstar.